nasal cavity and paranasal sinuses. The nasal cavity is a passage from external nose anteriorly to the nasopharynx posteriorly. The nasal cavity is passage يعني هو from the external nose to nasopharynx posteriorly. The nasal cavity يعني الفرونتال والإثمويدال والسفينويد and maxillary sinuses هي paired of sinuses are situated around and drain into the nasal cavity. This entire complex اللي هو nasal cavity and the paranasal sinuses هي lined by a mucus secreting epithelium. The nasal cavity is divided into two by a nasal symptom in a sagittal plane. A nasal symptom contains bony part and cartilaginous part. This is the nasal symptom. هذا يمثل لنا الكارتلاجينوس بارت والبوني بارت. البوني بارت اللي هو البيربنديكولار بليت اوف ذا اثمويد اللي هي هاي والفومر بون. هذا يمثل البوني بارت اوف ذا نيزل سيبتم. الفلور هسه راح نحكي على هسه حكينا على السيمتوم نجي نحكي على الوولز اوف ذا nasal cavity. الفلور اوف ذا nasal cavity is formed by البالاتاين بروسيس اوف ذا maxilla اللي هي هاي بالاصفر والهوريزونتال بليت اوف ذا بالاتاين بون. هاي البالاتاين بروسيس اوف maxilla تكون anterior والهوريزونتال بليت اوف ذا بالاتاين بون راح تكون posteriorly. lateral wall of the nasal cavity هو contributions of الماكسيلاري والبالاتاين واللاcrimal and ethmoidal bones. These form uncurved extensions known as turbinate or conchi. ما عدا الانفيريور turbinate او الانفيريور conchi هي تكون separated bone. Below each conchi or turbinate, there is what is called meatus. Meatus, this is from openings of the most of paranasal sinuses. There is area above the superior conchi or superior turbinate, نسميها sphenoethmoidal recess, which is received the opening of the sphenoid sinus. So this is the superior turbinate, and below it the superior meatus, the middle turbinate, and below it the middle meatus, and the inferior turbinate, and below it the inferior meatus. Here is another picture for the anatomy of the lateral wall of the nasal cavity, showing the turbinates. Here it is diagrammatic presenting the inferior turbinate والnasal septum والmiddle turbinate and the sinuses اللي هي around the nasal cavity. This is the ethmoid, maxillary. The blood supply of the nasal cavity. The nasal cavity is rich of blood supply, and many branches supply the nasal cavity, anterior and posterior ethmoidal arteries, which is branches of the ophthalmic artery اللي هو يجينا من الانترنال carotid artery. يعني internal carotid بينطي الophthalmic artery, then it is give the anterior and posterior ethmoidal artery. Another artery اللي هو sphenopalatine artery اللي هو large artery. This is the sphenopalatine artery, also branch of the ophthalmic artery. So this is anterior posterior ethmoidal artery. And the superior labial artery, which is a branch of the facial artery, which is a branch of the external carotid artery. طبعا اكو فد clinical area here يسموها كيلسل باخ plexus او يسموها lights area. يصير انستوموسيس بين between all these arteries, and so it is viable for bleeding, what's called epistaxis. So now we will talk about the paranasal sinuses. Paranasal sinuses, it is an air-filled cavities lined by a mucus-secreting epithelium within the bones of the skull and located around the nasal cavity and open into it. Function of these paranasal sinuses, يعني voice resonance, reduce the weight of the skull. The first one is the frontal sinus. The frontal here paired, most of these sinuses are paired. The frontal sinus located between the inner and outer table of the frontal bone. This is the frontal sinus between the inner and outer table of the frontal bone, and يعني تكون مكانها medial to the orbit, supraorbital area. This is by CT, the frontal sinuses. طبعا maybe it is asymmetrical, يعني not strict انه تكون symmetrical right and left. Maybe it is asymmetrical. The ethmoid sinuses اللي هي divided into anterior group and posterior group. These consist of labyrinthine of bone cavities or cell situated between مكانها بين medial wall of the orbit and the lateral wall of the nose. Here it is, the ethmoidal sinuses اللي هي تقسم إلى anterior group and posterior group. Ethmoid sinus between the medial wall, here it is the orbit, here it is the medial wall of the orbit, and it is called the lateral wall of the nasal cavity. The sphenoid sinuses, this is located, paired of sinus located in the body of the sphenoid bone. Maybe it is incompletely separated from each other, may appear as a single sinus. Or maybe it is subdivided like ethmoid by small bony cells. They are closely related to ethmoid, as we saw. It is closely related to the ethmoid sinuses. That it may be difficult to distinguish the boundaries anatomical, يعني may be difficult to distinguish the boundaries cavernous sinus and on its lateral wall, and it is also from the roof of the nasal cavity. Here it is the sphenoid, and it is an important anatomical relation to the pituitary at the silla torsica, and here it is from the roof of the posterior part of the nasal cavity. Here is another CT scan, show the frontal sinus and nasal cavity, sphenoid sinus and its relation, silla torsica, and here it is the nasopharynx. Now, the largest sinus in the skull bone, the maxillary sinus, or what is called antra. It is the largest paranasal sinus and sometimes described as having body and four processes. The processes اللي هي orbital process, here it is the orbital process to upward and medially. The zygomatic process toward the zygoma, and the alveolar process, which is downward to the teeth, and the palatine process, which is participate to form the roof of the oral cavity. The body of the sphenoid, it is a pyramidal in shape, extended superior-medially, here it is superior-medially, to form what's called the uncinate process, bony part, thin bony part, what's called the uncinate process. And laterally, to participate in the contour of the cheek, and also it is curved to participate in the infratemporal. It has curved infratemporal or posterior surface, this يعني behind this view. And it is from anterior wall of infratemporal fossa. Above is and this is the bony part separate from the cheek and medially from the mouth with alveolar cavity. And here open here into the middle meatus. Here is الاوستيوم والانفندibulum والmiddle meatus. هذا totally what is called osteomeatal complex, known as osteomeatal complex. هاي nasal bone، راح نشيل nasal bone. Ethmoidal bone, and this is the vomer bone. Clear? Here by coronal CT scan showing the nasal cavity, inferior turbinate, middle, and superior. And this is the maxillary sinus, pyramidal shape. Will sinus appear as a triangular in shape. And this is the ethmoidal cells. This is the sphenoid air cells. فملخص الكلام اللي حكيناه احنا انه nasal cavity هو extend from the external nose into the nasopharynx and surrounded by a group of paranasal pairs of paranasal sinuses, which and it is opened into the nasal cavity. الاوبننجز طبعا ما حاطه سلايد بس we will talk about them. انه السفينويد sinus open into the sphenoid sinus open into the sphenoethmoidal recess, which is located above the superior turbinate. The above below the superior turbinate نسميها superior meatus, which is receive the opening of the posterior ethmoidal air cells. Open here, and this is the middle turbinate. Below the middle turbinate, it's the middle meatus. Receive the opening of frontal, anterior ethmoidal, and maxillary sinuses. All these sinuses open into the middle meatus. And the inferior turbinate below the inferior turbinate is the inferior meatus. It is received the opening of what is called nasolacrimal duct اللي هو اللي transmit the tear from the eye into the nasal cavity. تمام أستاذ. I finished the talk about the lecture. Now start with the quiz.
اوكي هسه بس فد لحظه.
تمام خذ راحتك أستاذ.
اليوم النت ضعيف اني ساعة التليفون.
والله أستاذ هو ضعيف وين ما تروح. أنا أصلا طلعت من البيت رحت لغير مكان شوي عمود النت أقوى يعني.
اي ماكو هسه مالك الراوتر انقطع تقريبا. يلا اوكي ابدي.
اوكي أستاذ راح يطلع الرقم او ورا ما يطلع الرقم يطلع الخيار. نمبر 1 نمبر 1
اشر لهم عليها اشر لهم. خلينا نختار. منو نختار؟ نور محمد جواد.
اي نعم استاذ. رقم 1 هو نيزل سبتم.
الواحد نيزل سبتم. سالي عبد الرضا.
رقم 2
بل
الماكسيلاري ساينس.
يا هو الليفت الرايت؟
هذا الليفت.
الليفت. عقيل.
نعم أستاذ.
رقم 3
ميدل تيربينيت.
الميدل تيربينيت. عبد الكريم ناهل.
أستاذ رقم 4 inferior turbinate.
inferior turbinate. دكتورة مريم.
inferior nasal turbinate.
نعم دكتور.
نمبر 5.
نمبر 5 right superior meatus.
right superior meatus. عندنا هبة. دكتورة هبة.
نعم استاذ.
نمبر 6
middle meatus.
ها
middle meatus.
middle meatus. excellent. يا هو الليفت لو الرايت؟ ها الرايت.
نعم.
زين. عندنا جازان.
نعم أستاذ. right inferior meatus.
نمبر 7 right inferior meatus. excellent.
نمبر 14.
ها
حاليا يعني احنا ما اخذنا كل الارقام يعني نمبر 14 هسه حاليا.
نمبر 14 نور بابا.
Ethmoid Sinus.
Ethmoid Sinus.
رايت ethmoid sinus. مضبوط.
left والرايت مهم طبعا.
اي طبعا.
بعد عندك.
نعم استاذ 15.
رنين رفعت.
نعم أستاذ. number 15 right sphenoid sinus.
right sphenoid sinus.
last one.
بعد
last one 16.
last one نختار زهراء علي رشيد.
نعم دكتور. Sphenoid recess.
Sphenoid recess.
عاشتي لك استاذ.
ويدك عاشت يدك انت. و very nice lecture ومختصرة to the points.
يعني